13. Early signs of heart failure that you ignore. Every day. The heart is a very important organ that pumps blood all over the body to supply oxygen and nutrients. When it can't pump efficiently, various parts of the body start to suffer. In this video, we will discuss 13 early signs of heart failure that you may ignore every day. Stay tuned. Number 1. Shortness of breath. Shortness of breath is one of the most common symptoms of heart failure. When your heart isn't pumping efficiently, it can cause fluid to build up in the lungs. This fluid can make it difficult to breathe, especially when you're lying down. If you find yourself struggling to catch your breath, especially when you're doing activities that require more energy, like climbing stairs, you should see a doctor. Shortness of breath can also be caused by other conditions, so it's important to rule out other possibilities. But it's definitely something to be aware of and not ignore. Number 2. Swollen legs, ankles, or abdomen. Swelling in the legs, ankles, or abdomen can be a sign of heart failure. It's caused by fluid retention, which can happen when the heart isn't pumping properly. The fluid backs up into the veins and can cause swelling in different parts of the body, especially the lower extremities. So if you notice that your legs or ankles are swollen, even though you haven't been sitting in the same position for a long time, it could be a sign of heart failure. Similarly, if your abdomen is swollen, it could indicate that fluid is backing up into the liver and other organs. Note 3. Persistent cough. A persistent cough that doesn't go away with treatment can be a sign of heart failure. The fluid that builds up in the lungs as a result of heart failure can irritate the lining of the lungs and trigger a cough. The cough may be worse at night or when you lie down. It could also be accompanied by wheezing or shortness of breath. If you have a chronic cough that hasn't responded to treatment, it's worth getting checked out to rule out heart failure. Number 4. Fatigue. Fatigue is a common symptom of heart failure. When the heart isn't pumping efficiently, the body doesn't get enough oxygen and nutrients, which can lead to feelings of tiredness and exhaustion. Even simple tasks can become more difficult, and you might feel like you don't have the energy to do things you used to enjoy. If you're experiencing persistent fatigue, especially if it's accompanied by other symptoms like shortness of breath or swelling, it's worth talking to your healthcare provider. Number 5. Rapid or irregular heartbeat. A rapid or irregular heartbeat can be a sign of heart failure. The heart tries to compensate for its reduced pumping ability by beating faster. This can lead to an irregular heartbeat or arrhythmia. If you notice that your heart is racing or you can feel your heartbeat in your chest, it could be a sign that your heart isn't functioning properly. Additionally, an irregular heartbeat can put extra strain on the heart and worsen heart failure symptoms. Number 6. Dizziness or lightheadedness. Dizziness or lightheadedness can be a sign of heart failure. When the heart isn't pumping efficiently, it can cause a drop in blood pressure, which can lead to feelings of dizziness or lightheadedness. This can happen when you stand up too quickly or when you're exercising. If you experience these symptoms, it's important to sit or lie down and rest until you feel better. If you have persistent dizziness or lightheadedness, especially if it's accompanied by other symptoms of heart failure, you should consult a doctor. Number 7. Chest pain. Chest pain is a classic symptom of a heart attack, but it can also be a sign of heart failure. When the heart isn't pumping properly, it can put extra strain on the heart muscle, leading to chest pain. The pain can feel like a pressure or tightness in the chest and may radiate to the left arm or lower jaw. If you experience chest pain, especially if it occurs during physical activity and goes away with rest, it could be a sign of heart failure. However, chest pain can also be caused by other conditions, so it's important to seek medical attention right away to rule out a heart attack. Number 8. Frequent urination, especially at night. Frequent urination, especially at night, can be a sign of heart failure. When the heart isn't pumping efficiently, it can cause fluid to back up into the veins around the kidneys. This can make the kidneys release more urine, leading to frequent urination. You might find yourself waking up more frequently at night to use the bathroom. If you're experiencing this, it's important to stay hydrated, but limit your fluid intake in the evening to reduce nighttime urination. Number 9. Changes in bladder control. Changes in bladder control, such as an increased urge or frequency of urination, can be a sign of heart failure. When the heart isn't pumping efficiently, it can cause blood to back up into the veins that drain the lower part of the body, including the pelvic area. This can put pressure on the bladder and lead to changes in bladder control. So, if you notice any changes in your bladder habits, it's important to talk to your healthcare provider. Number 10. Cold hands and feet. Cold hands and feet can be a sign of poor circulation, which can be caused by heart failure. When the heart isn't pumping efficiently, it can cause blood to pool in the veins and arteries, which can lead to a feeling of coldness in the hands and feet. If you notice that your hands and feet are always cold, even when you're in a warm environment, it could be a sign of heart failure. However, this symptom can also be caused by other conditions like peripheral artery disease, so it's important to consult a doctor. Number 11. Dry cough. A dry cough can be an early sign of heart failure, especially if it occurs in people who have had a heart attack in the past. When the heart isn't pumping properly, it can cause fluid to build up in the lungs. This fluid can irritate the nerves in the lungs, triggering a dry cough. The cough may be worse when lying down or at night. If you have a dry cough that doesn't seem to go away, it's worth getting checked out to rule out heart failure. Number 12. Unintended weight loss. Unintended weight loss can be a sign of heart failure. When the heart isn't pumping efficiently, it can cause fluid to back up into the lungs and lower extremities. This can make it difficult to eat and digest food, leading to weight loss. Additionally, heart failure can cause changes in metabolism and appetite, which can also contribute to weight loss. If you're losing weight without changing your diet, it's worth talking to your healthcare provider. Number 13. Blue-tinted skin. Blue-tinted skin can be a sign of heart failure. When the heart isn't pumping efficiently, it can cause a drop in blood oxygen levels. This can cause the skin to have a bluish tint, especially around the lips, gums, and nail beds. If you notice that your skin has a bluish tint, it could be a sign of heart failure or another condition that's affecting your blood oxygen levels. It's important to note that these symptoms can be caused by other conditions, so it's important to seek medical attention if you're experiencing any of them. Early detection and treatment of heart failure can prevent further complications and improve quality of life. Remember, knowledge is power, and by staying informed about our health, we can make positive changes and live better lives. If you found this video informative and want to learn more about similar topics, click the link in the description below to watch another video on heart failure. Thanks for watching.